Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting and from viewers like you.
Hello and welcome to Louisiana Public Square. I'm Beth Courtney, president of LPB, and joining us to moderate tonight's discussion on long-term care in Louisiana is Robert Travis Scott, president of the Public Affairs Research Council. Welcome, Robert.
Welcome. Good to be here, and thanks, Beth. I look forward to a robust conversation about a topic that really affects a lot of us.
It does indeed.
And now, according to the Pew Research Center, 10,000 people turn 65 every day in the United States. By 2030, America will need 6 million individuals to care for its aging population. For poor seniors in Louisiana who need long-term care, 77% of state funds support institutionalization. The rest goes to home care options. In most states, the ratio is 60-40. So attempts to equalize this imbalance failed in this recent legislative session.
Well, Robert, you know, it is a complicated topic, and nearly 30,000 nursing home residents on Medicaid could be forced out of the facilities if the current House version of the budget stands. The document eliminates an eligibility program that provides services for 80% of Medicaid clients. So what type of care does Louisiana's aging population want? And is the state supporting it? We explore these issues and more on Balancing Eldercare. If you're elderly in Louisiana, on Medicaid, and want to receive long-term care at home, be prepared to wait. There's already a significant backlog of applicants for the state's alternatives to nursing home care.
Currently, the wait list for long-term care waivers, community choice waivers, and adult day health care waivers is 28,000 people, a little over 28,000.
Andrew Mull is Associate State Director of Advocacy for AARP, Louisiana. He says the wait time for Medicaid waivers can be 7 years or more. Their popularity reflects the type of care that the elderly desire.
90% of people want to live at home, and that's backed by every survey and every study we've done.
AARP supported legislation this session that would have put seniors on Medicaid into a managed care system. Under the plan, private insurance companies would choose the type of care each client should receive. Mull says the move would create flexibility and cost savings.
You improve options to home care and to other long-term care options that are out there. You do it in a cost-effective manner. Home care is much more cost-effective than nursing facility care.
The average annual cost to the state for a home and community-based resident is between $13,000 and $33,000. For a nursing home resident, the cost is about $47,000, but nursing homes are all-inclusive.
For home and community-based programs, it's more tailored. You're in your home, maybe you need 8 hours a day, maybe you need 6 hours a day, maybe you need a ventilator. It's tailored to what your needs are, and if your needs are less, then it's going to cost less.
Rebecca Allen is an investigative reporter for The Advocate, who received national recognition for her series on Louisiana's nursing home industry. Despite being the more expensive choice, nursing homes receive more state support than alternative services.
In Louisiana, we have laws and policies that tend to favor the nursing homes over home and community-based programs. 77 cents for every dollar spent on elderly care goes to nursing homes instead of home and community-based services.
From 2006 to 2016, state Medicaid payments to nursing homes increased 54%, while occupancy rates increased by less than 1%. Mark Berger heads the Louisiana Nursing Home Association. He admits that nursing home reimbursements have increased, but at a slower pace than overall state Medicaid spending. Plus, the rate paid is minimal.
I've been tracking the statistic for 27 years. Over that 27-year period, Louisiana's Medicaid rate is either the lowest or among the lowest in the nation. But yet we're able to provide quality care with that low reimbursement rate.
That quality is questionable, though. Louisiana ranks dead last in quality of care on the AARP Foundation's long-term services scorecard. But Berger says a more complete picture of Louisiana nursing home quality comes from the Centers for Medicare and Medicaid.
Of the 15 long-stay quality measures that are tracked by the federal government, Louisiana meets or exceeds the national average in 9 of those 15 measures, so 9 of 15. Of the remaining 6, we're sometimes within 0.1% of the national average.
Louisiana consistently has improvement in their quality rankings. When you look at our region, which is a poor region of the country with poor health outcomes overall, Louisiana ranks very well in our health outcomes, and we continue to make dramatic improvements.
Joe McPherson is a former state senator and owner of a Lafayette nursing home. He feels that proponents of the Medicaid managed care model are giving false hope to people waiting for waivers.
Any individual in a nursing home is automatically at the top of the waiver list if they care to go into the community. That says a lot that there's people in nursing homes that are there for a reason, because that's what the families desire, that's what the residents desire, that's where their doctors say that they can receive the care that they need. So to try to make people believe that they're going to be able to move up on the waiver list or be able to move into home and community-based services because of some mass exodus of nursing home patients just isn't correct.
The major appeal of nursing homes, McPherson says, is their one-stop shop aspect, a convenience you don't receive with waivers.
They've got their hair salons in the nursing home, they've got their social activities, the doctor comes to them. We have a full-time nurse practitioner in most nursing home settings now. So it's all inclusive, and it's all included in our rate.
Senator Conrad Appel sponsored the long-term managed care legislation this session. While it failed, he says due to pressure from the nursing home lobby, the model has already proven successful in 22 states that have tried it.
There were no states that have dropped out. Some have been doing this for as long as 25 years. Most report substantial savings, and there are other states that are investigating moving in this direction at the current time.
While Governor John Bel Edwards could expand managed care to cover the elderly through an executive order, he indicated that it's not economically feasible now. However it happens, Senator Appel is convinced that the move is inevitable.
People are living longer, they're living healthier. They don't want to be stuck in an institution. The political demand is going to force this change anyway. Whether it happens next year, the year after that, or 2 years down the road, doesn't matter. It's going to happen.
Joining us to discuss elder care in Louisiana is our studio audience. It includes members of the AARP, the Advocacy Center, and 3 administrators of nursing homes from Shreveport, Wisner, and Winfield. We also have high school students from the Legislative Youth Advisory Council. So welcome, everyone. Well, in a 2015, a survey was conducted by the U.S. Department of Health and Human Services on long-term care. And among its findings, the majority of respondents had high expectations of their own longevity, with 82.1% believing that they had at least a 50% chance of surviving to age 85. 22% rated their chances of living beyond that is 95%. The vast majority of respondents were willing to take specific actions to remain in their home should they need long-term care. 82% were willing to make modifications to their homes. 75% plan on having a family member as a caregiver, and 70% will have a family member or a friend move in. Only 29% were willing to move into a nursing home. An Associated Press survey found that while 30% of long-term caregivers perform some kind of medical care, from changing bandages to inserting catheters or feeding tubes, only 47% of those say they had the training needed for these often delicate tasks. So let's start from there. What about your own family's perspective? What do you think is the best long-term care for the elderly? And let's start with Wendy. Let's start with you, because I think you have a story to tell about your family.
Yes, I do. I want to begin by saying that my mother took care of her mother for many, many years. And she lived to be 96 years old. Then at the end, when she could no longer take care of her, she went into the nursing home. She was well, but within the month she had passed away. And so at a young age, I had pretty much decided that I felt like to put your parents in the nursing home, they may feel they're no longer useful, no longer needed, and their will to live just goes away. So 8 years ago, she came to live with us.
And what is your mother's name?
Her name is Jeannie Watts.
Okay.
And I'm blessed in that my husband is a builder, so he built a little apartment right next door to our house. She was able to live independently by herself. Everything was fine. She's a very, very independent woman. She would help with cooking and taking care of the kids, and it just worked. But as the time went by, I noticed that she would need more help. And I really do believe that some of the funds need to be distributed to those caretakers to help with, for example, my mother does not like to stay by herself ever. So we never go on vacation. We never go anywhere, do anything. So I would love some professional caretakers to come out and help out, nurses, anything.
This is a good perspective, and I want one of the nursing home administrators to speak up and sort of give your perspective on what she just, Keith, what do you think of what Wendy was just talking about?
Well, as a nursing home administrator, and I've been doing it 22 years now, so I've got a lot of experience at it, and we're definitely not opposed to folks being independent and staying at home. And that is the goal of any nursing home administrator in our facilities when they come into the facility, is we want them to be independent, and we work to help them be independent. There does come a time, though, that a individual needs long-term care and needs that specialized care that you really receive in a nursing home. It's kind of that one-stop shop they were talking about earlier. Mm-hmm. The reality of it is that, and to Wendy's point over there, and certainly admire the fact that her family was so diligent in taking care of their loved ones. A lot of families aren't able to do that. And, we live in a society nowadays to where there's not a lot of family members that live together. Used to be you'd have 5 or 6 siblings in one area that could all go together and take care of a loved one at home. Well, nowadays you got 1 or 2 and sometimes an individual person that just doesn't have the resources and ability to do that.
Let me ask the question at this point, or maybe someone wants to jump in. So if they don't have family who can take care of them, is it important to have an alternative for staying at home? Does anybody want to address that?
Sure. I'm glad to hear Keith say that the goal is for older adults to live independently and to live where they have choices, because that's exactly how AARP feels. Then that's backed by surveys and studies that we've done for a long time that say that people do want independence and do want to live at home. And I think the challenge really is that there aren't enough, that we're going backwards with our long-term care spending. As it was said during the opening, several states are moving towards more of a balance, and Louisiana is going the exact opposite direction. Mm-hmm. And that's where we can really see a lot of room for improvement, and that's why AARP is currently working to find, AARP as well as other organizations, there are several groups that are supportive of this, to find ways to rebalance our long-term care system, because I think everybody agrees that that's important.
Okay, I want to go to Ashley. Let's go first to Matt. With you are also a nursing home administrator, and I think you have a slightly different perspective, and then we'll come back to you.
Well, to Andrew's point, we don't disagree that people should live at home when it's appropriate. The nursing home industry in Louisiana actually now, Mr. Scott, sends more people back home after rehabilitative care than expire in the facility.
You have family yourself who've been through this situation, right?
I have, yes, sir. One of my grandfathers had vascular dementia, and much like Miss Wendy's family, my family was able to make the choice to keep him at home, and we were able to care for my grandfather until he expired at home. That same grandmother had a knee replacement, came into my facility, received about 3 weeks of rehabilitation, and then she went back to the community where she stayed the rest of her life. Mm-hmm. On the other side of my family, both my grandmother and grandfather came in and out with different episodes of rehabilitation until their conditions deteriorated that they no longer could live at home. Like Keith was saying, on that side of my family, the resources simply weren't there to have somebody stay with them all the time, so they came in the facility and stayed until the end of their lives.
Ashley, you wanted to jump in on this.
As a person that receives home and community-based services myself, I think that it's important to rebalance this to have more long-term regional care options, because it gives people the ability to have choices and to live and be productive in their own community. And it also gives them the choice to be independent and live their own lives the way they want to.
Yeah, I hear what you're saying. And Carmen, you're with the Louisiana Budget Project, right?
Yes.
Okay, and y'all have a real interest in healthcare issues. Can you reflect on what Ashley just said about the need for this type of care and funding for this care?
Yeah, absolutely. And thank you for your remarks, as well as Matt and Keith. I am thinking, because I am a public health and health systems person and advocate, I'm understanding that real change for a system takes decades sometimes. And considering how our population is changing, how our legislature does business, we have to start now in thinking and taking some critical steps, making hard decisions and hard choices to create the system that is going to sustain us, the system that we want, the system that people are literally asking for. We can do that, but it will take our industries to begin to relinquish some power and relinquish the power over the funds to be sure that we're providing that dignity for everyone to receive the care that they want in the place that they want.
Thank you, Carmen. Wes, what do you think of what she just said? Do you need to relinquish some power?
So we keep talking about choices and providing more choices. And just to be clear, the proposal that we're discussing is that managed care companies would make the choices for you. An insurance company would make the choice for you. Iowa is a managed care state. There's an article which discusses a person with Alzheimer's who was receiving home care. Her hours of home care was cut nearly in half because she, quote unquote, wasn't getting better. So it's not the person's choice, it's the insurance company's choice as to their care.
And to be clear, you're talking about legislation that was proposed this year but did not pass.
That's supported
right?
by ARP, that's correct.
Oh, okay, and you thought that would be a mistake because the nursing homes didn't want that type of care, or you think it's also not good for the people?
I don't think it's good for nursing homes, and I don't think it's good for home and community-based services. There's documented cases in these states where the home and community-based services are going bankrupt. They're not getting paid, the services are being cut, and it's all because of the choices of the insurance company.
Well, I'm afraid that's all the time we have for this portion of our show. And when we return, we'll be joined by a panel of experts to further explore balancing elder care in Louisiana. Welcome back to Louisiana Public Square. Tonight we're discussing balancing elder care, and joining us now is our panel of experts. Jean Abadi works at the Advocacy Center of Louisiana, which advocates for people with disabilities and long-term support services. Abadi has been a member of numerous work groups that help to develop long-term care waivers for the state. Mark Berger is the executive director of the Louisiana Nursing Home Association, which represents more than 250 nursing and assisted living facilities. A CPA, Berger has more than 27 years of experience working with the association. Hugh Ely retired after working for over 30 years at the Governor's Office of Elderly Affairs and the Louisiana Department of Health. He was instrumental in establishing Louisiana's first home and community-based waivers for the elderly. And Senator Jay Luno, a Democrat from Alexandria, who is serving his second term. An attorney, Luno was one of 6 senators on the Health and Welfare Committee who voted down the Medicaid managed care legislation this session. Well, Before we go to our audience questions, I wonder if each of you could tell me from your perspective, is elder care in Louisiana balanced or imbalanced? And if so, what does that mean? And we're going to start with Jean Abadi with the Advocacy Center.
Thank you. I would say that it's definitely imbalanced. If you look at just the services that Medicaid pays for older adults and people with adults with disabilities, adult onset disabilities, 77% of those services go toward providing services to people in nursing homes. I think that alone tells you that the system is unbalanced because people who want to stay at home aren't being given the option to do that. They can typically get into a nursing home if they choose to, but they can't stay at home and receive that care when they really need it. And I think that as we look at the system, we need to broaden those options and change that balance and make it a more closer to 50-50.
Well, thank you, Ms. Abadi. And now for a completely different perspective, Mr. Berger with the nursing home.
Well, thank you. One is the Nursing Home Association supports home and community-based services. It's for us, it's not a us versus them. And we would like to see the expansion and the ability of people to stay at home as long as they possibly can do. But I'm a CPA and I look at numbers. The same AARP scorecard that was presented in the opening, which may not reflect the true quality of care presented in Louisiana nursing facilities, but we rank 29th best, according to that scorecard, as it relates to balance. As it relates to individuals first receiving home and community-based services before reaching an institution, we're the 23rd best. Additionally, we have the 4th lowest Medicaid reimbursement rate in the nation. We're the 4th lowest. So while I understand the desire to stay at home as long as possible, I think looking at the numbers, the balance may not be exactly as it is portrayed.
I see. Okay. Now, Hugh Ely, you've probably had a great deal of experience in government and the public policy side, more than most anybody else in Louisiana. You've had a lot of time to reflect on these things. What do you think about the balance?
Well, we are more balanced than we were a long time ago, but not as balanced as we were just a few years ago. Everyone agrees, and from the comments that the folks made here previously tonight, we need all forms of care. We need institutional care, facility care, we need home and community-based services. We need all those things to have a good system. But we historically were last and had almost no community-based services at all. We made a lot of progress between about the year 2000 and about the year 2010 and got all the way up to 14th in the nation. But what's happening now is we are going, from a spending perspective and from the number of people being served in each setting, we are going in the opposite direction. And I think that's the challenge for people who want to see a balanced system, is how do we stop going backwards and get back closer to the national average.
And why is that happening?
It's a combination of things. It's some laws that have been enacted to help the nursing home industry maintain its funding, and there's been no corresponding action like that for community-based services. There have been freezes on community-based services being offered to people because of the budget issues that have been going on for the last 6, 8, 10 years.
I see.
So it's a combination of factors.
Okay. And Senator Luna, you're right in the middle of all the action, and you get all the praise, all the blame. So tell me, what do you think of the balance or the imbalance?
I think it's probably imbalanced, but I think I have a little different opinion from some of the other people. I think it's imbalanced because we don't properly fund it. You can't pit one group against another when there's not enough money to go around, and that's what's happened in Louisiana. So I think where we need to concentrate our efforts is getting more money to take care of these seniors and keeping as many people as home for as long as we can, because that is ultimately the goal. But we can't lose sight of the fact that typically the most frail of these folks need to be in nursing homes where they get 24/7 care, and that's why we concentrate funding in those areas.
So it's not always the right paradigm to look at just nursing homes versus home care in terms of the funding policy and everything else. Okay, very interesting. Well, we have a young man, Micah, here, who has a question for all of you, speaking of funding and what happens to state funding. Micah?
Okay, so I know that funding previous fundings for Eldercare is now going towards TOPS and higher education, and we know the history of TOPS being funded going between fully funded and partially funded.
And Micah, TOPS is the state-funded scholarship program for students.
Yes.
Okay, right. And
So can we expect funding to go in between Eldercare and TOPS in years to come?
It's a funding issue. Senator, you probably are the best one to try to field that
Well,
question.
I can certainly weigh in on that. Micah, the issues that we have, that we're facing currently, there's not going to be any money to go anywhere. With the budget that was passed from the House over to the Senate, it's not, all of these programs are not going to be funded. The real issue is, when are we going to look at our tax base and do something about that in Louisiana? We have a broken system of taxes in Louisiana. We exempt over $8 billion a year to various corporations, that some of which don't pay any taxes in Louisiana. We need a more fair system. We need to correct our system and put in lower corporate tax rates, but do away with many of these exemptions. And I think if we start to look at that and we get fiscally responsible, then I think we can properly fund programs like this.
Thank you. You know, we've heard in this whole budget crisis that there might have to be notices sent out to nursing homes and to people with medical care that there won't be enough state funding to handle that. I don't know, Mark, is that a real threat?
That is a very real threat. If the budget maintains the cut to the Medicaid eligibility path for the majority of our nursing facility residents that are receiving Medicaid, which would be about 80%, then nursing facilities will close. But before that occurs, the state will issue notices. We heard in the legislative testimony today, those notices may go out on May the 1st, alerting the families that they may no longer receive their Medicaid eligibility. It's our estimate that will impact about 16,000 residents. And the human side of receiving that notice saying you will no longer receive these benefits is tragic.
Jennifer, you're with a nursing home administrator, is that right?
I am.
What's your perspective of this?
Well, as an administrator, I've dealt with managed care and home and community-based services, but also as a power of attorney for my grandmother who had Louisiana Medicaid, home and community-based services. I think I have a unique perspective in dealing with both sides. And I can say, while even she had 2 stays in the nursing facility, she at 92 always wanted to be at home. She'd been there since she was 16 years old. That's not always a possibility if you can't stand up to make a cup of coffee. And if we talk about the 77 cents on the dollar that we get in long-term care, I just don't think it's a fair comparison. It's not apples to apples, because we're providing 24 hours a day of nursing care. And so many people that come for short-term rehab end up coming back because they want to be there.
John, do you want to follow up on her comment there?
Sure, and I'd like to also say that people receiving home and community-based services are also going to be getting those letters. About 80% of those people will be getting letters and being told they won't have home and community-based services. They may not be able to get into a nursing home either, so we're going to have a problem. To respond to that, I'd say that typically a person going into a nursing home doesn't require 24-hour nursing services. People who go into nursing homes go in under what's called different pathways. Some of those pathways don't even require that a person need assistance with any activity of daily living. None of those pathways require that somebody need nursing services 24 hours a day. So when you look at that 77% and you try to look at it as a staffing issue and saying that nursing homes need the money because they have to pay a nurse to provide assistance 24/7, they may have an LPN or an RN available 24 hours, but they're not there providing care to somebody for 24 hours a day. So I do disagree with that.
And there's a lot of contention in just what the basic facts are here and the perspectives to look at them. Eugenia, you have a question for the panelists.
So I was wondering, who decides whether the patient is able to stay at the nursing home or go home, or where they are in their health situation? Like, I just wanted to know, like, if it was the insurance who decides that, or if it was the family, or if it was the nursing home, or who communicates that?
Eugenia, we're going to let our policy wizard, Hugh Ely, answer that question.
Thank you, Robert. Let me look at, first of all, to go into any of these Medicaid-funded long-term care services, whether it's in a nursing home or in the home. A person calls up a toll-free intake number and they are given an assessment, and later they get a face-to-face assessment. And based on how they score on that assessment, as John says, they qualify for services. The minimum qualifications are the same whether you're going into a nursing home or whether you're going into a waiver or a community-based program. That's required to be the same by federal law. That's not to say a lot of people who applied aren't much worse off than that minimum standard, but the minimum standard is the same. The person basically then has a freedom of choice if the services are available, and that's again by federal law. If I choose to go to a nursing home, then that's where I can go if there's one available. And if I choose community-based services, oftentimes it's not available because there's a long waiting list. States are allowed to put caps on that. They're not allowed to put caps on the nursing home care. I wanted to say something that the gentleman said earlier about the managed care allowing insurance companies to make those kinds of decisions. The managed care plan that the Department of Health and Hospitals had worked on a few years ago and the bill that was proposed that didn't pass both contain protections that it would not be the managed care plans who would be allowed to make those kinds of eligibility decisions about where people could go. When we were working on this a few years ago, we had a lot of input from stakeholders, providers, and advocates, and that was one thing they all agreed about. You know, we don't want the managed care plans to be given this kind of authority, and seeing what had happened in other states, we agreed with that, and so we put that protection in there, so that would not be something that the plans would do. The system would continue to operate the same way it does with people who are directly responsible to the state doing that assessment and then allowing
So you're
the person
trying to put
freedom
in
of choice.
managed care safeguards. That's what you were trying to do to protect the patient.
And
Danielle,
we're aware of what's
yeah.
happened in some other places and took steps to try to avoid that.
Danielle, you were a little worried about the future of home care, so you had a question about that for the panelists.
Yes, my question being that I'm a single parent now, and I have an uprising teenager getting ready for college. A couple of years from now, if anything happened to me, and as I get older, I'm gonna have to make her choose how to take care of me. Will she have to leave her life to come take care of me because she's my only child? Or will I have to put safeguards now in for later on because there's no way I'll be able to stay home if she's making her life? And I've never, even with my parents, I'd already was old enough to have made my life and have enjoyed my life, where I had the opportunity, as she did, to take care of them and walk them through that period. But she won't get that opportunity because I'm a little older than her, and she's just starting out. And 20 years from now, she may be put in that position if I don't make safeguards now. So what am I left with? Either tell her, now, send me to a nursing home, and that's not where I want to go, or we won't be able to afford to keep me home.
Yeah, can anybody afford it? Mr. Berger, do you want to try to answer that question?
Well, you certainly should begin the planning process right now for your future, and I think that's very smart. But I think you would need to look at, it's hard to determine what your health status will be as you move forward and as you age, and I think that will determine the location that you will need to receive those services.
It's a very difficult situation, but Jennifer, I think you wanted to jump in real quick.
I could, just to say that, because as an administrator, from volunteers, families, potential residents, all we continuously hear are that nursing homes today are not what they used to be, or not what they believed they would be. And so, Mark, I wish you would share with some what are nursing homes today and what should people know about nursing homes in Louisiana and what really happens there.
And Jennifer, you're trying to say they're better today than people think, or they're worse today than people think?
Oh no, they're
I didn't know which way you meant. Okay. They're better today.
A cup towel that said, "Be nice to your children; they will choose your nursing home."
Let's leave it with that point, because I want to go to Ruby, because Ruby had a question as well.
I do. As I'm hearing all of the perspectives, the advocates in some ways seem to say, no one should be in a nursing home, and that is not the case. I'm a family member 3 times, and with my dad, the experience was such that he needed to be there. He was there for 3 years and thrived. Later in the process, my mother and my stepfather wanted to be at home were not able to be long-term, and both experienced, I believe, good situations within a nursing home setting. But my question becomes, if no one should be in a nursing home, but there should be a range of options through funding, appropriate funding, managed care or otherwise, for individuals to be cared for at home, live at home with some supports, or in the community. How do we get there from here? What will a better system look like?
It's such a great question, because this is not an abstract policy discussion. This affects a lot of us very personally, and I'd really like to hear from the senator. You must get people asking you this type of question that Ruby has all the time.
I do, and we have some difficult decisions that we have to make in regard to those. The bill that we've discussed earlier by Senator Appel that was recently defeated dealt with those issues. I think the first thing you have to look at is, I agree with you, sometimes people need to be in a nursing home. They don't typically want to. I don't know of anybody that says, I want to go to the nursing home. In my own personal experience, my mother tells my brother and I all the time, when the time comes, no matter what I say, I want to be in a nursing home. I'm in my right mind today. I want to let you know that. And that's a comfort, because if that comes to fruition, I will feel comfortable doing that. I don't think that managed care is the alternative. Managed care has not been successful in most of the states where it's come up. We have been made so many promises in Louisiana about what we can do with health care that have not come to fruition. We were told we'll do away with our charity hospital system and we'll save money. We went from a $600 million bill on that to $1.1 billion. And I don't think we're providing more care. We're providing additional care, but I don't think we're providing better care. MCOs make their money by cutting services. That's what they do.
And was that the number one reason you didn't approve of that legislation to bring managed care?
The reason I didn't approve of the legislation to bring managed care was because no one could tell me how they were going to save us money. And I'm not going to sit back and vote for things on the promise of saving money. I want the proof. I want someone to explain to me what we're going to do. Again, my problem here is not that we're funding nursing homes. We don't have the money to fund all these programs, so we fund what we must. To me, the solution is to find additional funding to do these programs, to keep people at home, to help them stay at home instead of having to go into a nursing home. But the solution is not to take money from one and give to another.
Voris, you're just dying to jump in here, I can tell.
It's very pleasing to hear that, Mark, you're not against community-based care. You're not against it. You're not saying it's all nursing home. And I'm, listening to all the varying perspectives and all of that. However, Louisiana has been pouring more money into nursing homes for years as opposed to community-based care. And while other states are going in the opposite direction, we're the outliers. And why are we the outliers? Because we can have a variant options of community-based care, nursing home, based on choice and need. Why aren't we providing that and coming up with funding strategies or funding methodology to make that happen?
Well, let's ask that. Let's bring this question to Jean. And I mean, is it really the case? What you're saying, I guess, is what part of my question is, because a lot of people who are in nursing homes really need to be in a nursing home, probably wouldn't, and even the managed care plan that was being proposed wouldn't have drained people out of the nursing homes, not very many of them anyway. No. So Jean, Ms. Abadi, how would you address that?
I do think that, no, the managed long-term services and supports would not have taken people out of nursing homes unless they chose to leave and could. That would be a totally different story. But it also would provide the choice that people need, and that, I think, was why advocates were hoping that it could pass, is because it would allow people to have a choice as they were entering the system. It doesn't pull people off of the waiting list right away. That isn't going to happen. As far as the savings, I don't know if there are savings, but there are a generation of fees that would come into play, so that could help. And then eventually those choices could be offered, and maybe if there was more funding, that funding could go to provide more choices of home and community-based services that people are asking for.
And you know, Senator Luna said, you know, you've got to prove to me that about the cost issue and about whether it's going to be cost effective. But Hugh or Hugh Ely or Jean Abadi, how would you address his concern? He just told you what one of his major problems was with it.
Well, there are 22 states that have done managed long-term supports and services, and most of those states do report that they have either had savings, or when you're talking about long-term care and the aging of the population, to say you're going to save money, it's probably more accurate to say you're going to reduce the growth of spending, because the spending is always going to go up as demand goes up. But states like Florida, Massachusetts, Minnesota, several states, they've saved money from the same things you do with any managed care. They've avoided emergency room visits by getting people to go to the doctor and do preventative care. They've avoided rehospitalizations by being able to have better care coordination for somebody when they come out of the hospital. They're looking at a population that gets 15, 16 drugs sometimes, and they're able to go in and say some of these things are actually counteracting each other, not doing the person any good. So there are those typical kinds of savings that you can get. And then what Jean alluded to is that there is a mechanism that we use in our Medicaid program today, and in a lot of other areas of the Medicaid budget, where the insurance companies pay a premium tax, and the state can use that money to draw down additional federal match and bring in some additional dollars. So when you combine those two things, that's where you see a fiscal benefit to the state over the long haul.
Okay, and I want to go back to the audience for another question, but Mark, I want you to be able to have a rapid fire answer to what you just said.
Well, there is a premium tax that would be generated on a managed care plan, but insurance companies don't do this for free. They charge an administrative fee. That administrative fee is going to eat up any potential revenue from a premium tax. So the latest bill that was filed by Senator Appel, the accountants at the legislature documented a $2.5 million cost. So it would pull money away from a system that it's already drained to basically fund an insurance company.
And this is always the discussion when you get into this is whether or not the fee is going to be one cost, but then the managed care might save costs too, just by being a managed care system if it's doing it effectively.
And just one more thing. Just one more thing.
Okay.
I have been studying this for years. This is not new to us. We've looked at it in many different ways.
I know Hugh has too.
Yes, I have 100.
We've even studied it together.
That's true. That's true. I have gathered 117 articles from 13 different states documenting severe problems with managed care. And the sad part is, not only did it affect nursing facilities, it impacted home and community-based service recipients.
Why do you think managed care seems to work better, you know, for the general Medicaid population, not the elderly? There seem to be a lot of advocates saying it works, and that's what we have here in Louisiana. Why does it work there, but does it work in nursing homes, according to your opinion?
It doesn't work everywhere. That's the fallacy. There's one state that instituted a program that was similar to what was being proposed here in Louisiana, and when they got all in and they couldn't back out, the next year they had to come up with additional.
But my question is a little different. My question is that you have another Medicaid population that has managed care, and not everybody thinks it's great. A lot of providers don't think it's great, but by and large, there are a lot of people who think it's working. And why would that not be okay for the elderly care when it's okay for everybody else?
One of the issues that you deal with here is that it is very hard to audit, to police, if you will, these type things. We have more fraud, abuse, waste in these programs than we do in almost any other Medicaid program. And that's just, it's part of what it is, because it's so mobile, it's hard to keep up with it.
I thought managed care was supposed to help reduce waste, but we can keep pursuing that. But I've got to go to our studio audience back for a question. Nadia, you wanted to have a question for these folks.
We're talking about services right now. So we have the nursing home service. We have the service the community-based service. So I'm looking at it at a different perspective. So what if we had family members taking care of our elders, because we know that the family members know their elders and how to take care of them, and we can get community-based service people to help them. Wouldn't that cut down on funding and also the waiting list?
Yeah, this is a really basic question I think that she's asking. Wouldn't home care just have to be cheaper than nursing home care? I don't know the answer to this. I'm asking you, but a lot of people would think that. Hugh, you want to go first?
Let me, if I could briefly respond. Just the assessment that the legislature did with the bill, it did say what Mark said it said, but there was a much more sophisticated analysis done when we produced the RFP 2 years ago, where we had an actual rate, we had actual, and we did not make, they had to make assumptions. We didn't make assumptions because we actually had a contract written, and based on what was in that contract, there were savings that more than offset what the administrative charge was.
But that was for that particular program. Her question is kind of basic. I mean, just does
let
home
me-
care cost more than nursing home,
No,
or
it does
vice
not.
versa?
On a per person
No?
basis, nationally, it costs about a third
Than the nursing home
of what,
care.
of what
Mark, do you-
facility-based
do you-
care
do you-
does.
do
The
you think
numbers
that's
here
true?
in Louisiana, they're published on the DHH website regularly. You can look them up.
Do you think that's true, Mark?
Well, it's not an apples to apples comparison.
Okay,
So
okay.
I think
I'll
you're
grant you
looking
that.
at people in nursing facilities that need 24-hour a day, 7-day a week nursing care available to them. And you may have someone at home that may need 5 hours a day. So it's a much different population. I think if you looked at these three, if you walk through the homes of these three administrators that are in the audience, I think you would see the level of care that they provide and the quality level of care that they're providing on a daily basis.
Yeah.
And just if I could go back to Jennifer asked me a question about the changes in the nursing facility profession. We did a survey of our membership. Over 8,000 residents were transferred. If I extrapolate that survey, 8,000 were transferred from nursing facilities to the community. So, as I said before, it's not nursing facilities versus community-based care. We are working hand in glove to try to get our residents in, rehabilitated, and back home, and we're doing that successfully.
Yeah. Dana, you have this look of concern on your face, and I think you're leaning in.
Yes,
and
because I've been working with the aging population for over 25 years, and in 2 short years, 2020, we're going to have the largest elderly population in the United States history. And so it really worries me and the constituents that I care for about what's going to happen. And back to Ruby's question, if managed care is not the answer, or it's not a choice of, or not nursing home versus home and community-based services, what is the answer? How can we have a balance in Louisiana of home and community-based services and nursing home care? What is that answer, and how is the legislators going to support that?
Well, I think Senator Leno says a better revenue and tax and spending structure from what I gather. Is there any state where this is done in a balanced way with a type of revenue that streams that would be similar to what we have, or are other states just paying a lot more money for all those people who need the home care? Anybody could want to take that question?
There are states that started down this path to rebalancing as early as the early 1980s. And so I think if you look at those states, they have just had a lot longer time to get there, and they have made changes, and it's become sort of the norm that people have a more of a choice. There are, in terms of funding, one of the big issues, there are funding options available to the nursing homes that are not available to community-based services because they're not allowed in federal rules, the provider tax, for example. It would be great if you could do that. That would be one way to raise money, but the states looked into that over the years, and the federal government keeps saying, no, you can't do that. So there are other sort of disadvantages that they're at that are not these guys' fault, but
what about the other
disadvantages that are built into the system.
What about just the disadvantage of Louisiana, because we have so many poor here? Is that really what we're talking about here? We have so many people who are of such low income that this is part of the problem? Jean?
I actually don't think so, and the reason I say that is because our state, as I think Hugh alluded to, in 2009-2010, we had gotten to about a 40-60 balance, and we've gotten out of balance since then. And we have what's called home and community-based waiver services that are frozen and have been frozen, where people, that we had more of them and we have less than we had before. Do I think it's because we're a poorer state? Not exactly. I think it's just how, I think there have been laws passed that do protect the nursing home industry's rates and do protect the methodology of how those rates are done. And I think that tends to put more money on that 77%.
Wait, you said they protect the rates. Is that what I heard you say?
Mm-hmm.
Okay, so I don't. What does that mean? They protect the rates.
There is a constitutional amendment passed in 2014, and I might have that
Okay.
that actually says that the nursing home rates cannot be lowered. The LDH cannot lower the rates arbitrarily unless they lower it the same percentage across the board for all Medicaid services, or the legislature comes in and I do 2/3, or I can't remember. One of these gentlemen might know.
Yeah.
But yeah, it
Senator
actually
Luna
does
knows.
protect that rate, where home and community-based service rates are not protected and have gone down.
Is that your perspective too, Senator Luna?
Well, the first thing I disagree with is this
Okay.
this balance that we keep talking about, 40, 60, 50, 50, because it's my belief that the home health services are more expensive by the very nature of what you're doing. Instead of being in an institutional setting where you have a nurse who's going to care for multiple people, you have to have a nurse get in a vehicle and go to that person's home. That's more expensive by the very nature. It's not that it's better or worse, it's just more expensive. The other thing is, when you talk about guaranteeing rates for nursing homes, we're guaranteeing rates, but we're at one of the lowest reimbursed states in the nation. So,
and when you say reimbursement, what do you mean?
Who's
reimbursing whom for
the
what?
reimbursement rates that we deal with on the Medicaid program.
Okay, for Medicaid reimbursements to the providers of the healthcare services.
correct.
Okay,
So-
that's what you mean by that.
If I could just respond to and say that not everybody who receives nursing home services or everybody who receives home and community-based services needs a nurse to come to them. And so to say that is not exactly true, and the services are less expensive.
But if they go in a nursing home, they do need a nurse. They
no,
do need
not
nursing
necessarily. No, it's
not-
the exact
that's not
same.
actually
It's the exact same eligibility requirements. And no, they do not need to have nursing services according to what the eligibility requirements are. That is not exactly true.
It's ironic. About 2 weeks ago, I was at a conference in California where we discussed these issues with some of the leading experts in the country, and they disagree with you.
Well, it may be. Maybe they don't know Louisiana.
Well, we'll have to check your voting schedule 2 weeks ago. I hope that was on the weekend.
It was.
Well, let's let Susan come in here, because she's the only one who hasn't been able to speak up today, and she's feeling a little left out. So, Susan, what you got for us?
Well, so I'm listening to you all, and I'm hearing about things that have changed over the past several years in Louisiana. We were really bad. We got better, and we're maybe moving in the opposite direction, not only of the direction we were moving in, but of the rest of the country. And I wonder, how do we fix that? Is it just, as Senator Luna suggests, that we need to raise more revenue, or is there something else inherent in Louisiana's structure that makes us such an outlier?
This is a good question. We talked about poverty before, but this is a good question. Is there something different about Louisiana that affects this discussion? Mark?
Yes, Susan, and I understand. And I think if you look at our general population, the health of our general population, we're not a very healthy state away from health care. So there's a big...
But if the standards for home and community-based services and nursing facility services are the same, as I'm hearing, why would that matter?
Well, there would be one difference, and that is, in a nursing facility, a licensed physician has to approve your stay in a nursing home. So a doctor has said, you need to stay you can stay in a nursing home. You have to have a physician's order.
Okay, let's let Hugh talk about
Well,
this too.
if I could say two things. As John said, the criteria for getting into a nursing home and paid for by Medicaid is this assessment tool, and many people get in. There is no requirement that you get 24-hour nursing care. The standards don't even require only like two and a quarter hours of nursing care per day. That's the regulations for nursing homes. So, and it's not to say that people don't need to be there. That's not my point. But the population that are served in these programs look very much the same. The state does an analysis on this. They've done one several times in the past 10 years. They have to meet the same minimum criteria, and there's a range of people in nursing homes. If you go to a nursing home, you'll see people that are absolutely need total care. You'll see people that are up walking around, participating in activities.
There's quite a variety
the
of
same thing is
both
true
in the homes
in the
and in
home
the
care.
nursing homes. There is.
The other thing about the home care,
You got about 5 seconds, because I got to wrap up.
It doesn't. You're not sending somebody somebody out there to try to care for somebody one-on-one 24-hour. You're sending somebody out, going back to this lady's question, you're supplementing the care that they're already getting from their spouse, their family, or whatever. So that's why it's
now,
cheaper.
We're wrapping up. I'm going to give each of you really, and I mean this, 10 seconds. For what is the thought you want to leave with everybody going out of this? Jean Abadi.
I want to leave it that I think that choice is important. I agree it's not us versus them. It's about choice, and it's about people being able to make that choice when they need long-term care services.
Okay.
And I think we all need to work together on that.
All right. Can you be just as concise, Mark Berger?
Absolutely.
Okay.
I want to assure the Louisiana that nursing facilities are providing quality patient care and doing it at a very efficient rate.
Hugh Ely.
I would just echo Jean that the idea here is choice. We need both types of care. We need to find a way to do it and find a way to fund it, as the senator said. But we have a problem because the deck is sort of stacked on one side.
And the senators always get the last word. How about it, Senator Luna?
Well, I don't think we need more taxes. I think we need to quit giving away all of our tax money. And we need to quit pitting these two entities against one another, and we need to properly fund both of them so we can take care of our aging population, because that problem is not going to go away.
Well, thank you. Thank all of you. And we've run out of time for our question and answer segment. So we'd like to thank our panelists one last time, Ms. Abadi, Mr. Berger, Mr. Ely, and Senator Luna for their insight on this month's topic. You guys this was a great discussion. And when we return, we'll have a few closing comments.
A very good conversation, Robert, and complicated topic. And I see the wave of baby boomers coming at this problem.
I know, it's a real issue, but a good group tonight, a lot of tension, but a lot of good conversation too. I thought it was great.
Well, I need to know more about it. We didn't talk about how you need to staff this, so people need to be trained, or they need good caring people involved in this topic. And
Beth, it's all about the money in the end.
It's all about the money,
so we know that.
and I feel like I should run out and get insurance right now,
That's right.
perhaps. So, well, that's all the time we have for tonight's program. We encourage you to visit our website at lpb.org/public square to share your comments on tonight's show. We received several following last month's program, Making Schools Safe. And Robert, that was very a controversial program. Miriam wrote to us. She said, "I do not agree that bringing more guns into schools is an answer. I'm an active hunter and gun owner. However, I do not agree with regular citizens having access to military-style weaponry." And Jason asked that Senator Neil Reiser propose a school safety tax to fund a resource officer at every school, metal detectors, more guidance counselors, and better training to school personnel to recognize broken children. Well, we thank you so much for those comments, and we look forward to your comments.
Well, join us next month as Louisiana Public Square tackles another timely issue of statewide importance. That'll be on Wednesday, May 23rd. Well, thanks for watching, and good night to all.
Good night.
For a copy of this program, call 1-800-973-7246 or go online to www.lpb.org.